Health insurance, written and fact-checked by the editors of Encyclopedia Britannica. Health insurance system for the financing of medical expenses by means of contributions or taxes paid into a common fund to pay for all or part of health services specified in an insurance policy or the law. The key elements common to most health insurance plans are advance payment of premiums or taxes, pooling of funds, and eligibility for benefits on the basis of contributions or employment. Health insurance may apply to a limited or expensive comprehensive range of medical services and may provide for all or partial payment of the cost of specific services. Benefits may consist of the right to certain medical services or reimbursement to the insured. For specific medical costs, some types of health insurance may also include income benefits for working time lost because of sickness, disability leave, or partition leave. A health insurance system that is organized and administered by an insurance company or other private agency with the provisions specified in a contract is known as private or voluntary health insurance. Private health insurance is usually financed on a group basis, but most plans also provide for individual policies. Private group plans are usually financed by groups of employees whose payments may be subsidized by other employer, with the money going into a special fund. Insurance of hospital costs in the most prevalent form of private health insurance coverage. Another type is major medical expense protection, which provides protection against large medical costs but avoids the financial and administrative burdens involved in insurance small costs. Any system that is financed by legally mandated compulsory contribution or by taxes and whose provisions are specified by legal status is known as government insurance or social insurance. This type of medical insurance plan dates from 1838 when the government of Germany enacted a plan based on contribution by employers and employers in particular industries. In the United States, Medicare and Medicaid medical insurance for the elderly and the poor specifically are government insurance programs. The distinction between public and private group programs is not always clear because some government subsidized private insurance programs. Quite different, however, are government medical care programs, which are sometimes characterized as socialized medicine in the United States. In these systems are usually financed by generally tax revenues. Doctors are employed directly or indirectly by a government agency, and hospitals and other health facilities are owned or operated by the government. The National Health Service in the United Kingdom and the Veterans Health Administration's program operated by the US Department of Veterans Affairs are examples of such systems. In the United States, health maintenance organizations HMOs become popular in the late 20th century as a way to control medical costs through the use of pre-negotiated fees for medical services and prescriptions, medicines. An alternative to the HMO is the Preferred Provide Organization PPO, also known as Participating Provider Option, which offers features of traditional fee for service insurance plans such as the ability strategy of HMOs. For example, those enrolled in a PPO can see any medical provider at any time without a referral from a primary care physicians. However, if the insurer uses one of the insurance company preferred providers, the company generally pays a higher percentage of the cost. In the both HMOs and PPOS, the insured is usually responsible for a certain portion of the cost of the medical services, with a co-payment fee paid by the insured at the time of an office visit become one of the most common charges. Have a good day.